So, Doctor, you had already given us all the illustration. My inquiry is it 100% that after all this process, someone can get a baby, or sometimes it fails?
Yeah, that's a very good question, and it's a common question. Sometimes it fails. Yeah,
after all this process?
Yes, sometimes it fails because science in this field has gone very far. But as you know, science is relative. There is still some information also missing, but also sometimes there are some problems related to the process. For example, some people's eggs are not good quality, and so the end product, for example, the embryos will not be good, and their chance of attachment will be low. So also maybe the issue is in the womb. So sometimes they don't succeed, that's for sure.
I think we have an illustration the PD is going to send us so that we see exactly what happens. Is it this?
This is about how the embryos appear before you put them in. So, and these are real, these are our real things, pictures we take from our lab. That's, for example, when this is the egg, the first one is the egg which has already been fertilized. We see there that it has been fertilized. It has those two nuclei inside there, nuclei inside. Then the following day they will divide, and then they keep on dividing. This is the beginning of human being. What you see here, actually, this
is exactly what happens when fertilization
this one resulted into a human being, that is for sure.
Okay.
So what you see here is a child already on the road.
Really?
But yes, so the cells keep on dividing and dividing until they reach that stage on day 5, and then we put the embryo inside. Yeah, so this is showing what we see in the lab. And this is real, yes.
So the most challenging stage is normally the 3rd or 4th stage when you're doing IVF. Yeah,
so where it depends on what is causing the infertility. Sometimes the problem can come at any stage. Sometimes some people, the eggs don't grow at all. That may be the issue, and you don't continue with it.
In the first stage?
In the first stage.
Where you're doing the therapy?
Yeah, when you're giving the medication, the eggs don't grow at all. These are very nice eggs, yes, but you find eggs don't grow at all. You're trying to look for them, all the medications, you adjust the dose, you change the medication, no eggs grow. And this is probably because maybe the person has very few eggs, because we know the woman has a specific period of time during which she's having eggs, and maybe beyond that, the egg quality goes down. Yeah, so that is where it may stop. Or you may find that the sperms are not able to fertilize, so fertilization fails, yes. Or the embryos are not growing well, yes. So that also can be a problem. All these went well maybe, and when you put in the embryos inside, it didn't just attach for reasons which are beyond what you can see.
True. Thank you. Thank you so much,
So
Doctor.
it is very important for couples to know and to be able to talk with the doctor and determine what their chances are before they go into the treatment. It doesn't mean they cannot try, but they should be trying it when they know where they lie. Yes.
Thank you. A friend is asking that of late he took the wife for a pregnancy test, and they did that SCG test. It came out positive, but there is nothing. The doctors after that told them there is nothing in the sap. There's nothing growing. Yes, in the womb.
Yes. So when so positive HCG. So HCG is human chorionic gonadotrophin. This is a hormone which is produced by the immature placenta. Even the placenta continues to produce this. Now, as the placenta is producing it, it spills over in the blood, and if the level goes higher, it can go over in the urine. So you can test it in the urine or in the blood, and it is an indication of pregnancy occurring. Now, this doesn't mean that the pregnancy is normal. It just means that there is a pregnancy. Whether it will progress into a baby and to other later stages will depend on other factors. Yes, sometimes the embryo is not very nice, so it does not. So you get the embryo getting arrested at a certain stage of development, and it dies off.
Okay.
Yeah. So a positive pregnancy test is good, but it's not the absolute thing only.
Doesn't define that the pregnancy.
Yes.
Okay.
So usually after doing the pregnancy test, 2 weeks later we do a scan to see.
To confirm whether the baby is growing
or
not.
Yes.
Yeah.